Welcome to the discussion of question ID 109793 of the UWORLD Question Bank. In the case presented, the patient is alcoholic. Alcoholism is one of the predisposing factors for pneumonia. There is high fever. High fever is presented by dry skin and dry mucous membranes. Tachycardia and tachypnea are also present in fever. There is a productive cough. It's perion sputum. It means there is an infection. Crackles, they are the sound that you find if there is a fluid inside the alveoli. The bronchial breath sounds are normal if you hear them in the central part, in the trachea. But if you hear them peripherally or in the basal parts, it means there is a consolidation. You did a cardiac examination, it was normal, which basically means there is no ST3 gallop, there is no jugular venous distension. The cardiac examination is normal. This is important to distinguish between the causes of pulmonary edema if it developed. You requested a chest x-ray and there is a right lower lobe consolidation. All these things refer to one thing, pneumonia. So, it was diagnosed as pneumonia and treated as pneumonia. Pneumonia is treated with antibiotics. The first part of the case is pneumonia. Then, pneumonia developed something else. What did pneumonia develop? It developed acute respiratory distress syndrome. How did you know? Because there is a hypoxia. What's hypoxia? Hypoxia is drop of saturation of oxygen by pulse oximeter below 90%. In the case it was 80%. It means there is hypoxemia. Okay? And there is a worsening of the shortness of the breath. Like he was already dyspneic, but now he's even worse. He requested another chest x-ray. There is a bilateral diffuse infiltrates. This is typical in the acute respiratory distress syndrome. These diffuse infiltrates indicate there is a fluid inside the alveoli. This is pulmonary edema, and it's not cardiogenic, as we saw. There is normal cardiac examination. The treatment of acute respiratory distress is supportive. You cannot reverse the disease. There is no treatment to reverse the disease. You try to support it with intubation, and you try to treat the cause. Here it's caused by pneumonia. You already tried to treat pneumonia. There are other causes like pancreatitis, sepsis, trauma. You treat the cause accordingly. The choices have to relate to the pathophysiology of the acute respiratory distress syndrome. There is a fluid inside the alveoli. This fluid affects the surfactant. It decreases the surfactant. The surfactant is decreased, though the lung is stiff. It's less compliant. There's something called arterial pressure of oxygen and fraction of inspired oxygen. Fraction of inspired oxygen is constant if you are not mechanically ventilated. It remains 21%. This is the percent of oxygen in the air. But what decreases is your arterial oxygen pressure, because there is no gas exchange. How do you know that there is no gas exchange? The alveolar arterial gradient is decreased. What does that mean is the function of the alveoli is decreased, because the alveoli touches or comes into contact with the blood vessel, with the pulmonary circulation. The air inside the alveoli exchange gas with the vessels inside the pulmonary circulation. If this gradient, the gradient of oxygen inside the alveoli and the gradient of and the concentration of the oxygen inside the alveoli and the concentration of oxygen inside the blood vessels is decreased, there's a problem in the process of the gas exchange. It's either in the alveoli or the blood vessels, like pulmonary circulation. And the pulmonary arterial pressure will increase. Why does it increase? It increases because there is hypoxia. And if hypoxia happens throughout the body, there will be a vasodilation. But inside the pulmonary vasculature, the reverse happens. It vasoconstrict. So the blood can be deviated to the well-ventilated part. There is no cardiac cause of pulmonary edema. There is no congestive heart failure. And one of the answers was related to the fact that the left end diastolic pressure will increase. It means something related to the congestive heart failure, but that's not true because the cardiac examination was normal. If you have any questions,